Hey, let's talk about the use of lidocaine for vaginal pain. Now, there are a lot of different kinds of vaginal pain, but there's one particular type of pain called vulvodynia. And if you've been diagnosed with that, what it means is that you have pain in the vulvar region that isn't explained by other disease processes. So you'd want to see a doctor to make sure that, of course, you don't have another disease process like lichens or some other dermal condition, poor estrogen, that's causing the pain. In absence of another condition, that is when we would call pain in the vulvar region vulvodynia. Now, your pelvic physical therapist would likely do a test for you called the Q-tip test, where they check for a lot of different areas and they tell you whether you have something called analgesia, which means pain with something that shouldn't normally be painful, or hyperalgesia, things that might be a little uncomfortable being excessively painful. And so, as your physical therapist is treating you, one of the things they might recommend is lidocaine therapy. There are different kinds of lidocaine, so let's talk about it. One form of lidocaine is prescription, and it's 5% lidocaine hydrochloride ointment. This is lidocaine that is good for a specific area of pain on the outer regions of the vulva. So if we're looking at pain in this area, that would be helpful, especially inside the labia minora for 5%. When we look at the research, what we find is if people took a cotton ball and they applied this lidocaine ointment to the cotton ball, opened up the area there, the labia, and placed it in the area of pain and tenderness before bed, and then closed the tissue over it over 12 weeks, they had decreased number of painful sites even when the lidocaine wasn't still on the skin. You would want to use the cotton ball because ointment, when it melts, is just an oil, and so it just gets absorbed by the tissues. So using lidocaine would be very helpful. Then another form of lidocaine that one might use is 2% lidocaine jelly. And that is also a prescription. So that is a clear, thinner lidocaine that mixes very well with a water-based lubricant. And that could be used for sexual activity inside the vulva. I often recommend that people take a small applicator, or you can even buy 1 cc syringes that are empty, and you can fill that up and place it inside so that then when there's friction inside the vaginal canal, the nerve endings aren't as irritated and they're not so painful. Now, one thing to keep in mind with that is that can desensitize a partner. And so that could make the partner either last longer, which would be more friction overall, or what that could do is make it so little sensation for the partner that they have a difficult time staying engaged in the act. A third thing that is newer on the market is there are actually some over-the-counter lidocaines. So these are often 4%. There's one called from Desert Harvest called Relivium, and that's a wonderful moisturizing product. So say somebody's doing things during their workday and they're just getting that vulvar irritation that's bothering them, or their jeans are bothering them a little bit from the friction, or say they have to take a longer drive and they know that tends to irritate their symptoms and they want something that they can apply so that that's not an uncomfortable situation, that is a perfect solution for that. And because it is oil based, it has aloe in it, it has different moisturizers in it, it actually can help the tissue to be healthy. And it can also it could also provide a little bit of a barrier on the skin, so that if there's something that could be irritating to the vulva, like a little fabric softener on the undies or something like that, it can help protect a little bit. And that could be used throughout the day. There's also one that actually a student told me about today from Good Clean Love that is 4% lidocaine, and that is water-based. So that would be better to use as a lubricant and maybe could be used in place of the 2% jelly. I'm not as familiar with that product. So keep in mind that there are many, many, many reasons for vulvar pain, and vulvodynia is the vulvar pain that has been worked up for the other things, and we know it's not one of those things. And so what is left as a diagnosis of exclusion is just a painful vulva, so vulvodynia. These are some things that you can talk to your physical therapist and your prescribing provider about to see if they might be a good fit for you.